Hi, I'm Dr. Scott. The purpose of this video is we're going to discuss the 6 basic patterns that cause your thyroid to malfunction. If you want more details, go down to our main section. We have a lot of videos that go in more detail. This is just going to be a basic overview of how your thyroid works. And the patterns that can cause your fatigue, weight gain, headaches, sleep problems, depression, hair loss, all of these things because your thyroid may not be working right. But you know what? It may not even be your thyroid at all. So let's discuss it. So how your thyroid works is a whole cascade of events. And the whole thing starts with T4. So what happens is hypothalamus, which is in your brain, talks to your pituitary, that talks or yells at your thyroid gland to make 2 hormones, T4, T3. The main purpose of the thyroid is to make hormones. Keep that in mind. Make hormones is all it needs to do. Okay? So what happens is this. When T4 goes low in the blood, right, there's a message that runs up to your hypothalamus. The hypothalamus detects low T4. And he gets nervous and he goes, okay, I need to get the whole process. We need more hormone. We need more T4. So the hypothalamus tells your pituitary to yell at your thyroid gland. Okay? The pituitary says, great, I'll do exactly that. So the pituitary releases a hormone called TSH, thyroid stimulating hormone. The whole purpose of this hormone is to run down here and tell your thyroid or yell at your thyroid to make T4 and T3. Okay? Now, out of all of the hormone that comes out of the 2 hormones, the majority is T4 at 93%. So almost all of it's T4. And then you have a little bit of T3, which is 7%. But there's a problem with T4. Now, keep in mind, every single cell in your body needs thyroid hormone. Period. It's the spark that turns it on. T4 is inactive, which means it doesn't do any sparking of your cells. It doesn't do anything. It doesn't turn your cells on, only T3. So do you think it's possible your body can function on only 7% hormone that turns your cells on? No way. So what happens is the body takes this T4 and has to turn it into T3 or convert it into T3. So here's what happens. There's a truck right here. Okay? And this truck is called the TBG truck, thyroid binding globulin. This is how all the hormone circulates in your body. So rolls up to the thyroid, throws T4 on there, and what it does is this TBG truck comes over here and drops it off to your liver. Okay? And what happens is T4 gets turned into T3 at your liver. Okay? Now it also drops it over to your gut as well. And so your gut will turn T4 into T3 as well. So between those two, that's where 80% of all the conversion takes place in your body is your liver and your gut. So think of this. Let's say you have a gut problem. Right? And your gut problem, because for this conversion to take place, it has to be healthy at your gut and your liver has to be healthy. So if you have a gut problem, right, and you're not converting T4 into T3, is it possible it could give you thyroid symptoms? I'm saying yes, absolutely. Is it a thyroid problem? No, because what's the purpose of the thyroid? Is to make hormone. That's all it does, is make it. It doesn't convert it. So it's a gut problem, not a thyroid problem. Let's say you have a liver issue. Well, guess what? It's a liver problem that's giving you thyroid symptoms, but it's not the thyroid gland at all. Okay? So here's what happens. Remember T4. I'm going to put it all together for you. T4 goes low, the whole system starts, and all of a sudden the pituitary starts kicking out all this thyroid hormone to yell at your thyroid to make hormone. Okay? Now, your doctor checks your blood, and all of a sudden you have this T4, you have all this hormone in your blood. Your doctor goes, oh my goodness, you have a thyroid problem. Let's fix the thyroid problem. So what do they give you? T4. Synthetic T4. Is Synthroid or level thyroxine generally? Synthroid is T4, which we know what T4 is. It's inactive, right? Doesn't turn on any cells. So why did they give it to you? Because it was T4 that started the whole process. You raise T4 in your blood. It's at normal range now. Now the boss is happy. He tells the pituitary, no more, stop yelling at your thyroid gland. And so the pituitary turns off TSH. Now you recheck your blood and now you have a normal TSH. And your doctor goes, I just fixed your problem. But the key thing is this, is if this is step number 1, step number 2, and the final cell, here's the cell here, the final step in the process, step 10, medical doctors, traditional medicine handles step number 3. So when they give you the pill, what happens is that means it normalizes blood marker, and they're done. That's all that they do. Traditional medicine handles here. And that's why many times patients are given medications and they still have symptoms. Well, they fix the medical emergency because if your TSH goes too high or too low, it can kill you. So that's why the doctor gives you medication. It's a necessary thing. They need to do that, right? But if you take it, your symptoms go away, we know you weren't step number 3, okay? You were not step number 1. What should happen if you're, this is the first pattern, is pattern 1, is if it's truly your thyroid gland. So what it means, you take the hormone, your life changes forever. All your symptoms go away. You don't watch this video because things are good. Okay? If you're step number 3, you're pattern 1, your life changes forever. But only less than 10% of people actually are that pattern, pattern number 1. Okay? What are the other patterns? Well, we talked about them, is that conversion problem, right? The underconverting the inactive hormone into the active hormone T3. So it's a liver or gut problem generally. All right, so in those cases, you don't do anything for the thyroid gland, you got to handle the gut and the liver. Now there's another hormone we need to talk about, it's called cortisol. Cortisol is a hormone, it's your stress hormone, which is your belly fat hormone. It's the one that regulates your sleep-wake cycle, so it can give you insomnia. It'll prevent you from going to sleep or staying asleep. It'll get in your brain and actually give you short-term memory loss that leads to dementia and Alzheimer's. Is responsible for 50% of all female and male hormone imbalances. Okay? And what cortisol also does, if it gets out of balance, prevents T4 from being converted into T3. Which means all this could be working right, but the cortisol is just throwing a wrench in the system. Okay? What else can go wrong? Remember these trucks. Okay, what if the truck gets a flat tire or whatever, and the truck just isn't transporting hormone? Could it give you thyroid symptoms? Yes. Is it a thyroid problem? No, because the only purpose of the thyroid is to make the hormone. So female hormone imbalances like estrogen, for example, will cause these trucks to be an issue. Okay? The other issue that can go on is it may be a problem in your hypothalamus, your pituitary. Now there are 2 chemicals called dopamine and serotonin. You guys may have heard of that. They're your happy chemicals, but those can get out of balance and then they can't talk to each other properly. And that's the real issue. Which I want to tell you, you have more dopamine and serotonin in your gut than you do in your brain. Okay? Now, one of the last patterns you have is this. It's a condition called Hashimoto's. And Hashimoto's is responsible for 90% of everyone that's been diagnosed with a thyroid problem. So it's a lot of people. And what it is an autoimmune condition. And in these patients, the immune system punches the thyroid in the face and it attacks it. Okay, so if you're getting punched in the face all the time, you may have a hard time functioning in your daily activities. Well, same with your thyroid gland. Remember, what are the odds if you've been diagnosed that you have Hashimoto's? 80 to 90%. Okay, and in that case, it's not even a thyroid problem. Okay, it's an immune system problem. You got to handle the immune system. You got to calm it down. You got to find out why the immune system is attacking the thyroid. Okay, traditional medicine, remember, only handles step number 3, and that's it. And they do help people that are step number 3. But if your symptoms haven't gone away, we know you're not pattern 1. Okay, so those are the 6 basic patterns that cause your thyroid to malfunction. It's a lot more in detail, but watch my other videos if you want more detail on that. But in this case, we got to pull all the thyroid hormone to find out which pattern you really are. Pulling just the TSH and T4 just isn't enough. See you on the next video.